Today I'll be discussing biomechanics and functional movement of the knee. Tibiofemoral anatomy allows for 2 degrees of freedom, sagittal plane flexion and extension, and provided the knee is in some amount of flexion, transverse plane internal and external rotation. For sagittal motion, the knee can typically flex to at least 130 degrees, limited primarily by soft tissue approximation of the posterior thigh and lower leg muscles. For extension, the knee can typically extend past neutral around 5 degrees, limited mostly by bony congruence and capsulo-ligamentous tissue stops. Sagittal motion occurs about a medial-lateral axis of rotation near the level of the femoral condyles. This axis of rotation migrates posteriorly relative to the tibia with knee flexion, and migrates anteriorly with knee extension. For the transverse plane, available motion increases with greater knee flexion. In general, more external rotation range is seen than internal rotation range, with total rotation at 90 degrees of knee flexion being around 40 degrees. Essentially no transverse motion is seen at full knee extension due to the bony and capsulo-ligamentous stops. As the knee approaches terminal extension, 10 degrees of knee external rotation occurs conjunctly, known as the screw-home mechanism. The frontal plane of the knee is not considered a degree of freedom as motion occurs only passively and on a small level, but has implications for compartment loading and function. Based largely on relative femoral and tibial long bone alignment, knees can be more neutral, varus with the tibia adducted relative to the femur, which biases tibiofemoral loads to the medial compartment, or valgus, with the tibia relatively abducted, which biases loads laterally.